We talk about the skin a lot. We sometimes forget it is the body's largest organ. What are the primary functions of our skin that we take for granted? How do we maintain our skin? This is our focus today on sound health. Good evening, welcome. I am Olasunbo Mudupe. The program continues in a moment. Please stay tuned.
Most memos goes for release from the Accountant General office. So does it mean that the Accountant General can decide not to release the money? Sometimes they step it down.
Accountant General only release what is approved by the Chief Executive of the state. Accountant General cannot hold anything as far as the policy is concerned. But it is very germane to bring him into the discourse. I agree with him. Let him understand so that he can also fast-track or facilitate in prioritizing the release of the nutrition investment.
The governors are completely in charge. Speakers here can tell you when you do the budget. In fact, let me even ask, what budget do you do? The governors bring the budget and you pass the budget. And they carry the budget and go and implement and decide who gets what, when, and how, including the one that is budgeted for you, the legislature. So that is our brand of democracy. Let's face our reality. But that does not mean that we will sit down and cross our legs. No, otherwise we wouldn't be here in this room. Otherwise, people, gentlemen, wouldn't come fly all from the far north. For instance, my brother from Cross River State will come here to sit down. If we are not interested, if we are not interested in this conversation, if you do not think that since we started this conversation, we have not made improvements, or we have not made something to taking some right steps, and we are seeing results, and the results are reflecting in the outcomes and in the figures, we wouldn't be here.
The best investment you can have for your child and for the child of your neighbor who is going to school, who will have the best cognitive expression you will need to advance in their life and be productive citizens. And it's the best investment you can have for your country, Nigeria. Stay on with it, and God will help us achieve it. Thank you.
The program is still Sound Health on Lagos Television. Consultant physician and dermatologist Dr. Folakemi Cole-Adeife with LASUTH is joining us via Zoom to share our expertise on how best we can take care of our skin. Good evening, Dr. Cole-Adeife, and thanks for joining us.
Okay, good evening, and thank you for inviting me to be on the show.
According to the World Health Organization, the skin is the largest organ in our body. Sadly, we pay little attention to it, unlike other aspects of our health. Why is this so, Dr. Cole-Adeife?
Yes, as you've said, the skin is the largest organ in the body. It takes up about 1/5 to 1/6 of our body's weight, which no other organ does. And of course, it protects us from the outside world. It has several functions, and it's also the only organ that we can see. And so it represents us. It's like an ambassador and an overall reflection of our general health and well-being. And so the skin does require adequate care like every other part of the body. And I wouldn't say that we don't take care of our skin. Most people do. We bathe, we moisturize the skin, but sometimes we don't use the right things to take care of it. And so around this time, which we're celebrating World Skin Health Day, we're raising awareness about how best care for our skin and how we can, make our skin the best that it can be. And also it's important to know that there are over 3,000 skin conditions and skin diseases. And we have quite a number of skin conditions in our environment in Nigeria, which require, of course, dermatologists attention or health attention. And so we are also raising awareness about this because people often don't realize that when they have a skin problem, they should go to the hospital to have it treated because most people look at the skin as maybe a beauty thing. And so if they have a problem with their skin or its appendages, when I talk about appendages, I'm talking about the hair and the nails which come out of the skin. And when people have problems with their skin, hair, or nails, they are meant to see a doctor that is an expert or a specialist in skin, hair, and nails, and not just go to the beauty salon and, have the beauty therapist give them something. They should, just like when you have high blood pressure, you go to the doctor to write prescriptions for you. If you have a problem with your heart, your liver, your lungs, you see a liver expert, a lung expert. And also when you have a problem with your skin, you should seek out a skin doctor, a skin specialist. And that's what a dermatologist is, a doctor who has specialized in treating and managing conditions of the skin, hair, and nails.
I'm glad you mentioned a day was set aside to raise awareness about our skin. Following trends online, some people act enlightened, showcase natural skincare brands and routine. What is your take on this trend, especially when people try to achieve results overnight?
Yeah, so what I mean by people do try to take care of their skin, it just buttresses your point. Everybody's into cosmetics, skincare. So people are actually trying to care for their skin, but they're mostly going about it the wrong way because they don't have adequate information about how to take care of their skin. And they are following trends online on social media, and people are saying advertising one thing or the other, but those things don't actually, they're not good for the skin in most cases. So we on World Skin Health Day, we want to raise awareness about healthy skin practices. And not just on World Skin Health Day, it's something some of us do all the time. I decided to have an active page on Instagram and on TikTok and Facebook to educate people about skin health because we realize that a lot of the skin conditions we see in our clinics, in our dermatology clinics, could have been prevented by better knowledge about, how to care for the skin. And that's why this year's World Skin Health Day has the theme better knowledge, better skin health. Because if people are more empowered about how to care for their skin, there'll be less of the skin conditions, preventable skin conditions that we're seeing in our clinics on a day-to-day basis. For example, the problem of using skin lightening products. People feel that their skin needs to be fairer for it to be healthier and more beautiful. And this is absolutely false. All skin colors are beautiful, and healthy skin comes in every color and every shade. And in the process of trying to change your skin color, you can damage your skin. In most cases, the skin will become damaged. And now we are seeing more and more people in our clinics with damaged skin due to skin lightening practices. So, helping people to understand that this is a risk to your skin, and not just to your skin, to your overall health, because some of the agents used for skin lightening get absorbed into the bloodstream can lead to internal organ damage. So we need to educate people to avoid skin lightening products or toning, lightening, glowing, all those funny adjectives because they are harmful to the skin. And we also need to advise people to avoid using creams that are called triple action for just anything. A lot of mothers mix triple action creams into their babies' products because they say they want their baby's skin to be smooth. But these triple action products contain very strong steroids, which can damage the babies and the children's skin severely and lead to lifelong problems with their skin and even in their general health, can affect their growth, can cause hormonal imbalances, and can affect their organs like their kidneys. So we need to educate people. These are harmful practices that are very common. If you go on Facebook, you see some mothers advising other mothers to mix some tube creams into their babies' creams so their babies can be fair or their skin can be fresh. And a lot of mothers are doing this, not knowing that they are causing harm to their innocent children. So we need more education, public awareness, and guidance on how best to care for our skin from the experts, from the dermatologists.
Thank you for the enlightenment on the negative impacts of glowing, lightening creams and some online skincare on not just on our skin but internal organs. Dr. Cole-Adeife, is skincare actually expensive? Do I need to break the bank to maintain my skin?
No, you don't need to break the bank to achieve healthy skin. How do we have healthy skin? It actually starts from what you eat. It's not even just your skincare because it's a reflection of your overall health. So if you're not eating healthily, the chances are your skin is going to show that you are not healthy. So the first thing you want to do is eat fruits, vegetables, healthy, balanced diet, avoid junk food, reduce sugar, avoid alcohol, and also um, drink a lot of water. Those are things that can help your skin from inside. And our local foods are the best. So eating local fruits that we have, orange, pineapple, banana, agbalumo, mango, whatever fruit is in season, just try to eat some of them. Our local vegetables are also very good. We have different types of vegetable, gure, water leaf, ugu leaf, shoko leaf, okra, ewedu. These are rich in vitamins and flavonoids that help the skin and the overall body to be healthier. So we should embrace more of our local food and eat them regularly. It's the cheapest thing to drink. So drink water rather than drinking fizzy drinks or alcohol drinks. So that's not expensive. Then you go to the skincare. Our local shea butter and coconut oil are very good for our skin. So we encourage people to use them. Just make sure they are not mixed with all these tube creams. So if you're on a budget, coconut oil and shea butter can be used as a moisturizer and a gentle soap. We don't need harsh soaps. You don't need medicated soaps. You don't need all these new soaps that promise brightening and whitening and glowing. Just a simple toilet soap with shea butter is all that's needed. And then avoiding excessive sun exposure. So you want to reduce sun exposure because it can cause discoloration on the skin, can cause aging of the skin. We need a little bit of sun to produce vitamin D, but we don't need too much of sun because too much of sun can also age our skin faster than it's meant to age. So that's how to have healthy skin. And you don't necessarily have to use all these expensive products that are being marketed in, on the media. Sometimes you can use them if you have the resources, but they are not essential.
All right. Dr. Cole-Adeife, does my skin type determine the kind of skincare routine?
Yes, so our skin type, not our skin color, can determine the kind of product you should use on your skin. Now, there are about five main skin types. People have dry skin, oily skin, combination skin, sensitive skin, and normal skin. If you have a dry skin, you want to use something that is a bit more moisturizing. So, yes, your skin type can determine the kind of cream or lotion you want to use. People with the dry skin want to use something thicker that will help to keep their skin moisturized. If you have an oily skin, a thick cream might not be the best because your skin is already oily and you might feel uncomfortable. If you have a sensitive skin, you have to be very careful, avoid things that have fragrances. So once there's perfume or fragrance in the product, it's not ideal for somebody with sensitive skin. And with combination skin, you might need to mix and match. Some people have dry skin on the body, oily skin on the face, or even on the face, some parts are oily and some parts are dry. So you have to look for what works for you. So yes, your skin type can sometimes determine the kind of skincare products you need to use, but not your skin color. So all those people saying fair people should have a cream and dark people should have a cream, it is not true. That is, they are usually pushing skin lightening products when they say things like that.
A lot of people watching us right now think sunscreen is just for beach vacations. Do I need sunscreen before I set out?
Now, with sunscreen, yes, sunscreen is very important to prevent hyperpigmentation and to prevent premature aging in dark skinned people. It's not for skin cancer prevention for us. It's for skin cancer prevention for people who are Caucasians and people who have albinism. But because we are dark skinned, our melanin is protecting us significantly. And so we have less of skin cancer from UV, that's from sun exposure. But our skin tends to get discolored. You see black patches or patches around the eyes, patches on the face, and those things, people don't like them. So sunscreen can prevent that. So if you don't want to have different patches, different colors from sun exposure, you can avoid the sun and you can also use sunscreen to prevent that. Also, when we have things like pimples, acne, it tends to leave black spots. And these black spots are triggered by sun exposure. So to reduce the black spots, we ask people to use sunscreen so that they don't have those dark spots or black spots, what we call hyperpigmentation. That is why we advocate for sunscreen use. If it's not affordable, sun avoidance is also good. Wearing a wide brim hat, wearing protective clothing, avoiding the sun during the peak hours of the day. And if you can, please get a sunscreen. The challenge we have with sunscreen is good sunscreens tend to be a little bit pricey. And so it's for some people that might not be it might not be feasible or sustainable. But if you can afford it, please use a sunscreen when you are outdoors
All right.
during the day.
If you could distill your medical expertise into a simple 3-step daily routine that anyone can afford and follow, what would it be?
Yes, a basic skincare routine should have three major steps: cleansing the skin, number one, moisturizing the skin, number two, and protecting the skin, number three. So cleanse, moisturize, and protect. Cleanse with gentle cleansers. You don't need harsh cleansers unless you are prescribed medicated cleansers by your doctor, by your dermatologist. Simple cleansers are always fine. Number two, moisturize using a cream, a lotion, ointment, a gel, serum, depending on your skin type. And then number three, you protect your skin from the sun. You can do that by using sunscreen. You can do that and you can also protect your skin from pollution, which is very important for us in Lagos because it's an urban city with high pollution. You want to protect your skin from pollution. You can use antioxidant serums, things like vitamin C and other antioxidants. You can also eat your antioxidants by taking fruits and vegetables. But those are the three basic steps. Sometimes people may need a bit more, like exfoliating. It's not essential for everybody, but exfoliating can help as well. But those are the essential steps that everybody should, you know, have for their skin on a day-to-day basis.
Your final words as we bring this session to a close, Dr. Cole-Adeife.
Yeah, so love your skin, love your color. All skin colors are beautiful. We are black and beautiful in this part of the world, and our melanin is doing a fantastic job at protecting us. So let's stop trying to change our skin tone. Don't believe that it's only light people that are beautiful. We are all beautiful, created in unique colors by the creator. And love your skin. See your dermatologist if you have skin concerns. There are dermatologists in the teaching hospitals, in many general hospitals across Lagos. And if you have a skin concern, please try to book an appointment to see a dermatologist in the hospitals. Eat healthily, protect your skin, cleanse, moisturize, and protect. These are, my final words. And happy World Skin Health Day celebrations. Thank you.
Love your skin. All skin colors are beautiful. Protect your skin and see a dermatologist if you're experiencing a skin challenge. Consultant physician and dermatologist Dr. Folakemi Cole-Adeife. We appreciate your time and expertise on sound health.
It's a pleasure. Thank you very much.
You're welcome. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. Skin lightening, glowing products are harmful not just to the skin, but some internal organs. What you eat is a reflection of your skin. Mothers, avoid triple action creams or 2 creams for your baby. You do not need to break the bank to look good. Neither does your skin color determine the skincare brands or routine. Only your skin type. Cleanse, moisturize, and protect the skin from the sun. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.